Welcome to Alberta Health Services Daily Mouth Care Demonstration video series. This video will demonstrate basic toothbrushing technique that can be used with any resident or even yourself and your family. The goal of toothbrushing is to keep the mouth healthy by removing debris, food, and plaque from the teeth and gums. This helps to prevent dental diseases like cavities and gum disease, and it can also reduce the risk of lung infections in those who have poor general health. For the toothbrushing technique we will be using, we emphasize three things. First, hold the toothbrush at a 45-degree angle to where the teeth and gums meet. Using a 90-degree angle can be very uncomfortable and is not very effective in removing debris. Second, hold the toothbrush with a light grasp. This will feel the most comfortable on the gums. And third, use a short back and forth vibrating motion to loosen debris, food, and bacteria from the teeth and gums. Before beginning any personal care procedure, consider the PPE or personal protective equipment that you will need. During mouth care, you will come in contact with different body fluids like saliva and possibly blood and nasal secretions. These fluids could expose you to infectious viruses or bacteria. Assess each personal care situation and determine your risk. If the resident needs assistance with setting out their supplies, but is able to brush completely on their own, you probably will only need to wear procedure gloves. But if the resident needs you to assist with part or all of their mouth care, then you could be exposed to bodily fluids on your hands and possibly in the air. Consider wearing gloves, mask, and protective eyewear for the best protection. Let's begin the toothbrushing demonstration using the three tips that were just introduced a few moments ago. First, place the toothbrush at a 45-degree angle to where the gums and teeth meet. Second, gently brush the teeth with a short back and forth vibrating motion. And third, use a light grasp on the toothbrush so that you do not apply too much pressure that may cause discomfort to your resident. We know that care-responsive behaviors are more likely to occur when the resident feels discomfort or pain. By using these three tips, you can reduce the chance of discomfort for your resident. Remember to brush all the top teeth and the bottom teeth until you get back to the place that you started. For the inside, continue to use that 45-degree angle to where the gum and teeth meet. Make sure that the bristles of the toothbrush are touching the gums. For the inside of the front teeth, tilt the brush vertically and use the tip of the toothbrush to make your short back and forth vibrating motions. Continue to brush the insides of all the bottom and top teeth until you are finished. As you brush, look for any changes in the resident's mouth, like bleeding gums, broken teeth, or cavities. It's important to report these to the RN and LPN for follow-up, and it is also important for you to keep up the daily brushing routines so that it will slow down the decay or gum disease until it can be followed up. Next, brush the chewing surfaces of the teeth to remove any food and bacteria from the grooves. Finally, brush the tongue, starting at the front and moving back using a sweeping motion. By brushing the tongue, you will remove more bacteria. This will help freshen the breath and may even improve their taste and enjoyment of food.